Hello my friends, this is Dr. Richard Grant. I've been practicing cardiology here in the US for over 3 decades, and if there's one thing I've learned, it's that blood pressure is one of the most misunderstood parts of our health. Let's be honest, numbers like 136/86 can leave us scratching our heads. Your doctor might say, a little high, but you're fine. Google might tell you that you already have stage 1 hypertension. And then your buddy at the gym proudly says his pressure is 150 all the time and he feels perfectly fine. So who do you trust? The truth is, it's confusing, and a lot of people your age, 50, 60, 70, are living right in that gray zone, wondering, am I normal, borderline, or broken? So let's take a step back. What does normal blood pressure even mean? Well, depending on which guidelines you read, American, European, Indian, the numbers shift around. Some say you're fine up until 140/90. Others, like the American guidelines, say anything over 130/80 already counts as high blood pressure. And here's the first thing I want you to remember. These numbers are not commandments carved in stone. They're guidelines, designed to help doctors make broad decisions. But they don't know you. Think about it this way, if every shoe store only sold size 9, sure, a lot of people could squeeze into them. But many would be limping, silently hurting. Blood pressure works the same way. One normal number does not fit all. Your ideal pressure depends on who you are, your age, your lifestyle, your medical history, your family history. Let me give you an example. Imagine a 65-year-old man with diabetes, a history of smoking, and a pressure of 134/84. For him, that number is dangerous. It's like a house with cracks in the foundation, and the storm clouds are rolling in. Now take a 34-year-old woman, a little overweight but otherwise healthy, same pressure 134/84. For her, it's more of a yellow flag, time to cut down on salt, lose a few pounds, keep an eye on things, but she's not in immediate danger. Same number, very different meaning. This is why I always tell my patients, don't get stuck on the number alone. We're not treating numbers, we're treating people. And here's something else that surprises many folks. Most of us grew up thinking we're safe until we crossed that 140/90 line. But studies like the Framingham Heart Study, which has followed people for decades, show the risk actually starts much earlier, around 115/75. From there, every 20 points higher in the top number, your risk of heart attack or stroke doubles. It's not like walking along a flat road and suddenly falling off a cliff. It's more like a slippery slope, you've been sliding all along, even if you don't feel it. And here's the really tricky part, high blood pressure is usually silent. You can feel perfectly fine while damage is slowly building in your arteries, your heart, your brain, your kidneys. I've seen patients walk into my ER with a heart attack after years of being told their blood pressure was a little high, nothing to worry about. For them, that little was lethal, because they also had diabetes or high cholesterol or a family history. That's why context is everything. Now, let's flip the story. Some of you worry when your pressure runs low, like 98/62, or your mom's 90/60. Should you rush to the ER? Not necessarily. If you feel fine, if you're not dizzy, not faint, that might just be your normal, especially if you're young or you've been active your whole life. But if low blood pressure comes with symptoms, lightheadedness, fatigue, brain fog, even blackouts, then we investigate. Sometimes it's too much medication, sometimes dehydration, sometimes heart rhythm issues. So again, it's not just the number, it's how your body feels at that number. Here's the big takeaway: the goal is not the lowest blood pressure possible. The goal is a pressure that's low enough to protect your arteries, but high enough to keep blood flowing to your brain, your heart, your kidneys. In medicine we call it perfusion, making sure your vital organs get the oxygen and nutrients they need. That's what really matters. So what's your personal target? Well, if you're over 60, if you have diabetes, kidney disease, a past heart attack, or a strong family history, your normal may need to be lower than you think, maybe even down around 125/75. But if you're healthy, active, no major risk factors, a slightly higher pressure might not mean medication right away. It does mean action though. Don't wait until the storm hits. Start now, eat better, move your body, manage stress, sleep well, check your numbers at home. And by the way, if you're frustrated because your readings are all over the place, high at the doctor's office, normal at home, different on every machine, you're not alone. Blood pressure swings with stress, posture, even the time of day. Sometimes it's not the machine that's the problem, it's how we're using it. In fact, in my next talk I'll show you how to measure your pressure the right way at home so you can trust your numbers and not get lost in confusion. So the next time someone asks, "What's your blood pressure?" don't just give them a number. Think about what that number means for you. Ask your doctor, "What's my ideal pressure based on my risk?" Because at the end of the day, it's not about being normal compared to your neighbor. It's about keeping your heart strong, your brain sharp, and your energy steady for the years ahead.